Good afternoon, everyone. I fully understand how difficult the last 2 months have been for all of you. With the lockdown, the consequent difficulties in your daily lives, the economic hardship that many of you may be facing, and the worry and anxiety that you may be suffering for yourself, for the society, and for your family members. I would also like to thank Metsol for the immense help that they have extended to us during this period and for requesting me to record this conversation for the benefit of all of you, hopefully. Let me first start with telling you that every virus represents a combination between its deadliness and its infectivity. Deadliness means how dangerous the virus is in terms of how many patients infected with the virus will die, like Ebola, it's a deadly virus. Infectivity is how quickly the infection can spread. And please note that viruses do not want to kill people that they infect, because when people die, the virus also dies. Therefore, it is in the interest of the virus that the person stays alive. The coronavirus, or the SARS-CoV-2, as it is scientifically known as, has evolved to a great degree in achieving one of the most perfect balance between deadliness and infectivity. The death rate from coronavirus is not very high. More than 95% of the people worldwide who have been infected with this virus have actually survived. So, my first advice to all of you is do not panic even if you are tested for coronavirus. Chances are more than 95% that you will get better with relatively simple treatment. The main problem of virus is its extremely high infectivity, that is, the ease with which it spreads from one person to another and then to many others. And that is the reason why it is so important for all of us to protect ourselves so that we do not get infected with the virus. That's the key to containment of the disease. But how do we do that? In order to understand how we protect ourselves, we need to understand how the virus spreads. It does not fly in the air. It is not going to be there in a room air. Its main mechanism and the most important mechanism is to spread by droplets. Now, these droplets are produced when a person, under normal community circumstances, in hospitals things are different. Under normal community circumstances, droplets are produced when a person sneezes or coughs. But the good thing about droplets is also that the droplets do not spread far. It only spreads a meter or two under most circumstances. It can also survive on surfaces, plastic surfaces, metal surfaces. Estimates vary between few hours and a few days. But so far, all estimates have shown that they are unlikely to survive on surfaces beyond 72 hours, that is 3 days. So once we understand how the virus spreads, we will be able to better decide the logic behind what we should do to protect ourselves. So number one is wear a mask. By wearing a mask, you will be preventing possible infection from anyone else sneezing or coughing around you. For normal community circumstances, We do not need any specialized mask like N95 or others. All we need is a good quality triple layer fabric mask, and that should be washed on a daily basis. And mask should never ever be shared, and you should make sure that the surface of the mask that is in contact with your skin is not changed, is kept constant. The second most important thing is to maintain social distancing. Why do we need to maintain social distancing of about a meter or so? For the same reason, if someone coughs or sneezes around you, the droplets will not reach you. The third is, as I said, the virus survives on surfaces. We touch surfaces all the time, our computer keyboards, our mobile phone screens, we go to shops, we open doors, we open the basin tap, and therefore there is a possibility that you may contract the virus through touching the surfaces, and the best way to prevent it is by frequent washing of your hands with soap and water using appropriate hand washing techniques. Sanitizer is an addition. Sanitizer is not a substitute for hand washing. When you are traveling, you do not have access to soap and water, you use sanitizer. But as soon as you reach home, after shopping or any other activity, if you have access to soap and water, washing your hands with soap and water is the best possible thing to do. If you do not have access to water and soap, the sanitizer is the next best thing to do. But while using either soap or sanitizer, you need to make sure that you are letting enough time for the sanitizer and the soap to be in contact with your skin, and your hands are washed using appropriate techniques so that the spaces between the fingers and the space between the thumb and the other four fingers is also washed equally well. And the last step is avoid physically touching things that you do not need to or that you can avoid. For example, home delivery parcels, old boxes lying in different places in the house, or when you go to do your daily shopping to the market, touching things unnecessarily is also something that will help you preventing picking up the virus from surfaces. I also have to add that this virus, given its extremely high level of intelligence by achieving a perfect balance between deadliness and infectivity, will stay with us for some time. It is not going to go away. Lifting of lockdown does not mean that the virus has gone away. Lockdown has to be lifted, activities have to start, economic activities have to start. But with lifting of lockdown, the chances of infection are actually more because people will continue to mix with each other, and therefore the steps that I mentioned about personal protection at the community level, we must maintain an absolute vigil on those things for next many months to come till there is a vaccine. Also note, as of today, despite many researches going on in different parts of the world, there is no vaccine against SARS-CoV-2. There is no specific medical treatment against SARS-CoV-2. Various drugs are being trialed, but these are only trials. It has not been proved yet. As far as testing for the disease is concerned, the only acceptable test is RT-PCR. There are many other antibody tests, quick tests that are being planned, that are under development, but there is no clear evidence as of now that there is other clear tests that will identify the disease. Please keep these things in mind. I wish you safety. I wish you stay safe and maintain these personal